Hey everyone, it is Dr. Kyle Olson at Chiropractic First of Rockford, and I want to take a minute today to talk specifically about migraines and migraine headaches. And the reason why is because headaches are really one of the most common pains or symptoms that we see here at Chiropractic First of Rockford, and migraines specifically are a very common subset of headaches that unfortunately a lot of members in our community suffer from, and also one that we see a lot of success with treating and managing not just what can trigger those headaches for people, but also when they do happen, help significantly with the frequency and the intensity of the pain or the other symptoms that come along with that. Migraines themselves are a specific subset of a headache, and it's also a little confusing at times because headaches are not always present when there is a migraine. A migraine is actually a complex neurologic disorder, but headache pain specifically is very frequent with people that suffer from migraines. So, to know a little bit about the basics of a migraine, number one, it's something that tends to pop up first in either childhood or early adulthood. It is something that is much more prone in women. In fact, it's up to 3 times more likely to happen for women than men, in large part because hormones and hormone fluctuations are a very common trigger for a migraine episode. So women are more susceptible to that. It's important also to designate the difference between the cause of something and a trigger. And so we use the term trigger in our office a lot when people will say things like, yep, I had a headache after I did this, or whenever I do this, it causes. Well, the reality is it's a neurologic condition that's underlying. And so oftentimes when you can identify a specific action that you take or something that you do, and then an episode happens right afterwards, it's a trigger for it. It increases the inflammation in your body. It sets off a chain of physiologic events, whatever it might be, that actually pushes you into that condition versus being the true underlying cause of that neurologic disorder. So women are more likely to develop it, and it's something that is more likely to happen in childhood or early adulthood versus something you would pick up later, much later in life. Now, there are 2 specific types of migraines. The first is called a common migraine. This is a migraine that does not have a aura with it, and I'll explain what an aura is in just a moment. The other type is called a classic migraine, and this is a migraine that does have an aura. An aura is essentially a period of sensory disturbance. So it's things like pins and needles, feeling, when we talk about senses, it's your skin feels like it's on fire, or pins and needles, tingling, or it could be your vision, your senses when it comes to vision and hearing, taste, things like that. So you see a disturbance or an altering of those senses as well. So generally, this is something, an aura happens before you have a full-blown migraine attack with or without a headache associated with it. Your senses feel a little bit off, and this can be very different for different people. Some people get it, some people don't. That's one of the defining factors of common versus classic migraines. And again, I want to stress that a headache is very, very common with migraines, but it's not always there. For some people, they do get migraines and they can even be diagnosed with migraines by a neurologist or a specialist, but they don't have the headache that goes with it. But they have all the other symptoms like the aura, fatigue, all these other changes to their sensory inputs. So there are 4 distinct phases with a migraine. The first is called the prodrome stage. This can generally happen before you get any kind of aches or pains. This happens generally 1 to 2 days before an episode will happen or anything else happens. This is defined by things like hyperactivity, odd food cravings, irritability, low energy or fatigue, depression. Sometimes things like muscle stiffness or achiness can happen here as well. Basically, if you're somebody that suffers from this, you kind of know what's coming because for a few hours or a few days beforehand, there's something that's off, and that's called the prodrome stage. The next stage, if you are somebody that has an aura, is the aura stage. And again, this is a sensory distortion phase. So this is one where you get a pins and needle feeling in your face or your fingers or your legs. You might see flashes of light. You might see shapes or bright spots in your field of vision that aren't really there. You may have a temporary loss of vision, or you could have difficulty with speaking or articulating your words. These are all things that affect your senses and your perception of the world around you. The next one is the attack phase. This is the one that most people would think of, which is pain. And this can happen, and it can actually overlap the aura phase as well. So you could be having these 2 simultaneously. You feel dizzy or faint. You could have a severe headache. throbbing or pulsating feeling specifically. Oftentimes, this happens on one side of the head or the other, but it is possible to have it on both sides. It's also possible that it could switch from one side to the other during the same episode, but very frequently it's just on one side. Nausea or vomiting can happen at this phase if you get that with your migraines. Increased sensitivity to light or sound or certain types of odors, because right now your whole neurology, your sensory system is just overloaded. So any additional input essentially pushes it over the edge and just exaggerates it that much more. And then finally, the post-drome stage. So this is when you're coming down off of this episode. And oftentimes this is changes to your mood. Some people can feel very energetic or happy. They're coming down off of a very low place, so they're rebounding back up in the opposite direction. Other people, though, can still feel lethargic, and they have a lack of energy because their body has just gone through so much that it lacks the full recovery to get to this point. And a migraine attack can last anywhere from a couple hours to several days. This is all very personalized, and so it's not that migraines fit into this very small cookie cutter definition, but there's so many variances based on the individual with how long, what they feel, what makes it better, what triggers it. It's a very broad scope when it comes to defining what a migraine is. Now, I say all this with to offer some hope, though, too, because migraines are something that we and chiropractors across this country see very frequently. And because it is a neurologic condition, and because we are trained to assess and work with the neurology and work with your spine, we oftentimes see amazing results when it comes to managing the effects of a migraine, and specifically affecting the intensity, some of the symptoms associated with it, how long it lasts for, and just offering a better quality of life for many, many people. And for some people, we've seen complete resolution, but honestly, for other people, we don't. But they still see the benefit of maintaining their spinal health and their neurologic health to reduce these types of episodes. Specifically, I would tell you, if you're somebody that can pinpoint and say, yep, I really feel ache or pain right here at the base of my skull or right at the top of the neck. As chiropractors, we assess for subluxation or interference to nerves that can set off neurologic conditions like this. And the top nerves in your neck are the ones that are the closest associated with headaches. And those are also the same nerves that are going into sensory inputs like your eyes, ears, nose, and throat. And so that's one reason there's so much overlap between a migraine episode and pain in that area, is because those same nerves actually branch out and control several different aspects of this. And so if you are somebody that's dealing with migraines, or you know somebody that's dealing with migraines, and you maybe have tried or are trying to avoid going down the road of things like Botox injections or strong pain medications, or just neurologic medicines that depress the neurologic system and leave you feeling drowsy, chiropractic is an amazing alternative for many, many people to actually help assess and correct the subluxations and the neurologic impingements that are causing migraines for many people. Don't simply avoid the triggers, get to the cause, correct the cause, and see a significant improvement in the quality of the migraine that you're dealing with. Have a great day.